A lot of expertise, basically in epidemiological studies, health education, preventive medicines, public health education, medical and health professional education, health outcomes, climate change, antibiotics, and all these things. And he is definitely helping us out. First, we request Dr. Jugal Kishore to take over and tell us about the challenges of healthcare infrastructure facilities in COVID-19 times. So,
Thank
sir,
you,
this is your turn, sir. Thank you, sir.
Amit. Thank you very much. An IDM is allowing me or maybe giving platform uh, myself on various issues and particularly public health, because I really feel that disaster is a major public health issue. Now, a topic was given to me actually, the infrastructure safety in COVID time. So my focus would be on the infection control, not otherwise, because then the problem will be that structure has to be good for fire and then flood, and then every disaster have their requirement. That requirement is definitely there in when we talk about this infrastructure, because in bylaws and codes which are available for hospital, they are meant for all kinds of disaster. But when we talk about this COVID related issues, let it be focused on the infection, because I have been given only 20 minutes. I have to justify the time and we just focus on that area. Now these are the modern hospitals which I think everyone knows. We are coming with the closed buildings, big buildings, and they are glass, where everything is AC, air conditioning, which was not before. But most of our hospital, whether it is a private or a government, are coming with this kind of building throughout the country and the world, which I can say. So these are the modern hospitals. But you must have seen this kind of scenario when fire broke in the Kolkata hospital, Emory, and the way the patients, the people have been evacuated. You can imagine the problem faced. Somewhere the passes of the patient and the doctors and other not very good in certain situations. Now we have the Golden Hospital, like the old hospital, which used to be huge and open, and we used to have this kind of corridor where I think I have not seen any fire in the olden type of hospitals, because they are so open and there is no way the fire is there. But yes, they were, suffering from major earthquake and flood. Nowadays, we are having the concept of the green hospitals. When we talk about this green hospital, we just see that, we require a lot of the greenery, and in closed building, it's not possible. So we have to have some kind of, structure which is, made in such a way or constructed in such a way which allow the green areas to be there, and you feel much better when you are inside the hospital, and it also gives the appearance which is much better than just closed areas or buildings. Otherwise we develop the another disaster when you have closed buildings. And in occupational health, you must have heard sick building syndrome, which are common in the closed building. Now, when we talk about this hospital, we have the areas like the 5, 6 areas which are very, very important. One is, the movement of the, people, and then cleaning of the surface, then hand hygiene, and another one is the processing going on in the hospital that should be safe, and then water supply and sanitation related to water. So that makes the hospital, whether it is safe or not, as far as the infection control is there. Now, first important task of the hospital to be safe is having the infection control risk assessment. Now, this is the duty of the hospital staff, or say hospital administration management, to have such kind of team, and this team has to be multidisciplinary. It cannot be just one person from management and he can look after. No, many people are required, where the microbiologist, medicine person, and CPWD, or maybe the public departments, they should be part of it, and they try to assess. So the design of the hospital can be safe when they assess which are the area where you have more chances of infection transmission, and to identifying those areas and to make it safer. So that's the duty of this team, which need to be done regularly, because on the basis of this, that whole things is started. If the building is not correct, I think the renovation or retrofitting, or maybe I think the reconstruction or construction is required, because if you have a hospital, if it is continues to give infection, it does not have any meaning. The hospital has to be safe. It has to provide the safety, and maybe I think the treatment which should not lead to infection within hospital. The hospital acquired infection should not occur. Now, when we talk about the post-COVID hospital design, now in future, I think the most of the hospital now coming up, and they are start thinking that we have to cater the need of such kind of demand arise because of infection. For last 10 years, we have seen many changes, and in 2009 we have the swine flu, and now we have the COVID pandemic. So these two big pandemic has forced the hospital to be constructed in a manner which should able to provide the safety of the patient and the hospital staff. So that's what so the design is to be done in that manner. It cannot be similar to what we used to have. The cabin has to be separated, and it should be seen by the doctors or nurses in manner. So that is why the glass is required inside. Then the interaction with the patient and other can be done by our now IT solution are there. So it need not to be going every time to the patient and to other staff or colleague. So if we have the system of internet, and then the all electronic media can be used for this communication between the different kinds of stakeholders. Now this is recently seen that now the robot has been used in a big way. This is in Italy. Egypt is coming up, and then Israel is also working on the robots which are replacing our. So this need is arise just because of this COVID. Can you imagine that we had the dearth of expert, or maybe even if we have nurses and doctor, they were not willing to go to the patient, and without interacting with the patient and looking into the regular monitoring of the blood profile, or maybe I think oxygen level, all these things were very crucial in COVID management. So the robot has been used, and then we found very useful. So such kind of technology has to be developed, to make our hospital safer in future. This is the body which give the safety accreditations, and they make sure that the hospital perform all the processes and the design and everything in the manner that is not leading to hospital acquired infections. So that is required, and not all the hospital are NAB accredited, but it is the duty of the administration that they should always look for and maybe strive for making your hospital NABH, and maybe I think better bodies are there which can give you certification. When you get the certification, there is standardization of all the things occur, and then your services is qualified as a quality services. The one important area which is need to be think when we talk about hospital acquired and other infection transmission is the hand hygiene infrastructure. If you talk about hand hygiene, in many of our places, I have seen many hospital, we talk about hand hygiene, but there is no place of hand wash. So it should be part of the infrastructure of the hospital that you are, allowing the people to have the hand hygiene. So this design of hand hygiene factors include that you are ensuring the hand hygiene sink are available and they are separate. And adequate space should be available in the medical preparation, preparation and the splash guards, and wherever there are chances that a splash can be occur, or when you are washing the hand, it should not, go to some other. Then faucets such as should be operable, like you want to close it and open it, then it should be elbow, or maybe I think the wrist should be used, because majority of the time you are using your fingers, or when you have gloves again you are using fingers. So they should not be touched, and everybody should not touch those all areas where the transmission can be possible. Another important part is that it should not be the air dryer. So we should make sure that when you are having the hand hygiene or washing, then it should be either the paper can be used, or maybe I think the towel can be used, and it should not be used again and again. So paper wet drying is much better than the air drying, because air is spreading the infection. If the virus or bacteria is there, then it blow out. So that is a problem. Then installing alcohol-based hand sanitizer dispenser wherever it's not possible, and making sure that you are having proper placement of these, rubbers, scrubbers, or also maybe hand rub dispensers. And during the design process, make sure that hand hygiene processes, are seen explicitly, because we want that everybody should follow this hand hygiene. So we know that when to apply this hand hygiene, when you are touching the patient, so before that you wash it. When you touch the patient, then you come out, then again, or you are using, if you are touching the body fluids, or say the any kind of euro bag or maybe blood bag, then again you have to wash it. And when you want to do some procedures which are aseptic in nature, then you have to wash hand. So in many of the procedures and interaction with the patient in the cubicles, you require your hand should be correct. That is why in every place you have to have proper hand washing, and then the proper method of hand wash is also prescribed by the even WHO. And throughout the world we have now this special program on hand hygiene, and every doctor, every nurse, everybody is doing it. Next area is a reprocessing area, which again require a special design. A special design of the infrastructure of the hospital. These are the slicing and high level disinfection areas. Remember that flow of the space in those areas should be unidirectional, from dirty area to clean area. So it should be made in such a way. And then whatever the pipe, conduits, and duct work which is there in the sterilization unit, should be such that they are clean. It should not be, all dirty and falling something in that sterile area. Many a time when the hospital is very old, you will find such kind of thing which is not acceptable. And then sterilizer should be in a restricted area, should not be allow everybody going there, because that is a very, very important area. And then availability of the hand sinks, in that area also. So reprocessing area is very, very important in the hospital, should be made properly. So the infection should not occur because of your, slicing equipment and linen and all these things. These are, I think, some of the pictures which are showing that how different machines are used. And next area is a water-related infection control. Remember, the water supply is very, very important, like pipe water systems. You have the plumbing, and this plumbing is requiring the joints and the dead legs and encrustations, plumbing enhancement. And what is found out that in this area, I think you can have the Pseudomonas growth and Legionella, which can be there in AC duct. So remembering these all things, because you have done very good surgery, and because of the water which is provided for cleaning and other thing, you are introducing either Salmonella or Legionella, then it has no meaning. You can have the more problem because of complications. So for that, you require multidisciplinary water management team, in which you have to see that, the water piping, so the mapping is already there. So you see that mapping is properly done, analyzing where the hazard is, where the problem is, could be there in plumbing or maybe joints, and removing those all things, ensuring the level of chlorine required and the temperature of the water is required. So, you are making sure that whether the steam or a water is safe. And then for that, you require policy and regular checkup and monitoring, all these things part of it. And also assessment of the waterborne pathogens or maybe some other chemicals. And recently you have seen in one village recently in south that, pesticide contamination of water leading to so many, problems. So such things occur in hospital also. And this has happened in case of, when the oxygen supply is there. So you see that water supply in the air and the water and then oxygen supply. These equipment can be problematic if they are not properly managed and monitored. So the next is the cleaning surface areas. The environmental services are there, like the floor and then handles, and every part and corner of the hospital need to be cleaned regularly with the safe and disinfectant. It should not lead to some kind of injury to the our worker and also to our patient. So that is very, very important. The surface and design of the wards should be such that you make everything approachable, cleanliness is possible. So this requires a lot of infrastructure redesigning and making sure that if you have such kind of machine and if your surface is not very smooth, then you may not be able to clean the surface very well. So the area where the different kind of floor are required need to be designed, based on the assessment of the area. Or you require some other type of, disinfectant. There are various kind of disinfectant, could be radiation or maybe ultraviolet rays or some chemical or some heat. They all can be there. Next area is a flow of people, equipments, and there are things which need to be flow in the hospital. That also require a special infrastructure designing. The airflow is one where the pathogen can spread. So if you have AC building, so the AC can be the source of the infection transmitting from one place to another, if it is not properly like having the filter and properly. And that has been found out in COVID, that most of such kind of hospital does not allow to operate the ACs. That is why the restaurant and everything was closed down for this reason, because the AC, if we have a closed space, the AC will be there and then problem will arise. Even in summers, in our hospital, we were not allowed to operate the AC, and it was so difficult to stay in such kind of building where AC is must. So if you have such kind of situation, I think you require totally different kind of design, which will require a total infrastructure redesigning. Next is the flow of the people and the material. It should be smoothly done, should not be having the cross contamination and other thing. Now, if you have a bend, and if the flow of the patient or say the people in the hospital is acutely done, so you may have a chance of colliding with one another. So it is better to have the round curves and so seeing that how the building should be designed, so one should not have contaminations or cross infections, and respiratory hygiene and cough etiquettes protocol need to be done. So you have a sufficient number of these all spatules and all these things available, and marking and designing everything in that manner. So for that you require human factor engineering methods, where how the human will behave when the family members come, then how they will behave with one another. The family member, their patients are there. and they really want to see. So if you understand the psychology and the relationship and with the patient and also with the workers, then it become easy for you to make the design in that manner. You can see that one design we have prepared, and this is the time Ebola and swine flu and this time the COVID could have been properly managed. See, you require separate cubicles of each patient. This is the bed. So on the back side, like this is should be the open area, and this one is a corridor. So if the doctor or nurse comes, and then the movement of the nurse should not be directly going to the last patient. It cannot be. So it should not be. So the flow of the patient in that manner, that start dressing and then seeing the patient and coming out, and then the doffing and donning can be done in this area, and then seeing the patient, and it has the trunk exhaust is also on that side, and biomedical waste management should be done in that direction, not from the same route from where the doctors are coming, or from, because this waste can be very dangerous, like in Ebola, where the fatality is almost 60-70%. So even a small amount of the fluid can be very, very toxic and dangerous. So one cannot allow such mixing or using the same pathway. So we required such kind of designing of the flow of the patient. Next is the modality of isolation facility, like the single room, attached washroom and bathroom. Room need to be kept closed and no visitors should be allowed. Prefer maintaining the room in negative pressure, and then health workers attending in should wear the PPE, which is already done in COVID time. And then also seeing that this negative pressure is created, in that. So there are methods by which HEPA filter should be used when your chances of infection transmission is quite high. These are all different equipments are available where they are creating the negative pressures and pressure monitors and the filters and the portable units all are available and should be used judiciously. This design is very wonderful that patient's relative can come up to seeing the the ICU patient and can go back. So without any contamination. So such kind of design are really appreciable and should be done. So all depend how you want your hospital to have that arrangement. Next is just few words about the mobile hospital, because it has been done in our COVID time also. So when you are making the hospital mobile, they are much better because they can provide lot of facility in different areas and in a temporary settings, like in train has been used, and then tents has been used, and the stadium has been used. All those things when you're creating, then I think where many number of services can be made. So when you are designing, then I think you have to be ensured that the space between the two beds and also the cleanliness, and then separate cleaning and laboratory can be established. So that also need to be done properly. So what is required to be talk about this mobile hospital and way that they should also made in such a way that the contamination should not occur and infection should not occur in those areas. So with these words, I think I focus only on infection. It's related to COVID, and I have not talked about the fire and other disasters. So thank you very much. I'm ready for any kind of question if you have. Thank you. Yeah.
Thank you, sir. Thank you to COVID issues and COVID section, because I know that the situation. Thank you once again.
Jugal Kishore sir, wonderful presentation, lot of insights, no doubt about that. And a lot of queries are coming, but I will raise all those things towards the end. if you are staying back. I think Behal Saab is having some issues with thing, and we have to jump over his turn. So we are shifting to RC Sharma Saab. Sharma ji, are you ready? So we are going to Sharma Saab and listen fire safety challenges in hospitals and mitigation efforts during COVID-19 times. So Yogita, you can introduce Sharma Saab as well. And Sharma Saab again, an old friend of NIDM, and he's helping us in a big way. So you can give a formal vote of for formal introduction to Sharma Saab.
Sure, sir.
That's okay. I think we can skip that. We can skip that.
No. That is required.
Time left is little.
Be quick, Yogita, and do it.
So, all the lectures in different visit so I think is your
No, just a few words from my side as well. Sharma Saab. Sharma Saab is a recipient of various prestigious awards from various prestigious organizations like President's Fire Service Medal for Meritorious Services in 1996, President Fire Service Medal for Distinguished Services in 2006, then Director General CISF for Disc and Commendation for leading the CISF for rescue and relief in Bhuj earthquake 2001. So these are some of the credentials. His CV is running on 3 pages, so we can't read out everything. So and Sharma Saab is well-known fire mitigation expert, and the high quality is that he's having a master's qualification MBA in disaster management as well. So he's not only fire expert but disaster management expert as well. But he's now to shift slightly role as a firefighter in fire mitigation expert in hospital context. And Sharma Saab is, as I told, always helpful for NIDM, and he's assisting us or helping us out in a big way. So with this, Sharma Saab, you can take over, please.
Thank you, sir. You can share my presentation, please, from there.
Okay. No, give to me. Is it coming, Yogita?
Not yet. Showing that you are sharing the context, but not content not coming. Not yet, sir.
the share started, sir, but it is not yet.
It's coming, not coming.
So it's not coming.
No, but it's showing on my thing. I think it's coming now.
Yes, sir.
I'm sharing from this side. Is it coming or yours is coming? I don't know.
No, it's mine is coming, I think. So
Okay,
you can
right.
start.
Sir, only
That's okay. Okay. You can from no. You can do it. You from your screen. Yes.
No, I have just stopped.
Sharma.
Can you doing it?
No,
Shall I
now
try?
you have to do. I just stopped. You told me to stop.
Oh, 1 minute. Can you see that?
Not yet.
Can you see the screen? Seeing it? Okay. Can you see the screen?
No, sir. No, sir. Below. Then go to first option of the screen. Just go.
Some problem. I think I'm able to really do that.
So let me try again. I think so. Give it to me.
Let me say you try.
Okay. So Sharma Sahab, you can start.
Okay, right. Okay, go to the next slide, please. So full कर दीजिए screen.
हाँ ये हो गया. ये PPT में भेजा है ना, उसने भेजा है ना आपने PDF में.
ठीक है. हाँ, PPT में है. ठीक है.
नहीं
Okay.
PPT में नहीं, PDF में.
PDF में है.
But हाँ इतना ही चलेगा ये.
चलिए कोई बात नहीं. ठीक है. Oh, I think this is the second slide. Can you see the first one? Okay, next one. Please go. Next. Okay. We have the fire in a hospital infrastructure. Well, infrastructure is anything and everything which is there to be used in hospital. Now we have got buildings, the transport, water, power, sanitation, everything is there. And in addition to that, we are trying in case we don't have the proper power supply, UPS fails, or maybe oxygen availabilities can be affected, or infection control, you are trying to do waste management, then your net connectivity, anything could be there. I mean, these things are very much, so everything is important in its own way. But when you talk about buildings, but building strength of the building is one area where, I mean, we have to be careful that something goes wrong, earthquake or something. It can happen anytime, so the building should be strong enough. So if that is taken care of, it's a good thing. But then next is the fire. If there's a fire, then it's a normal situation. Also, it is very difficult to handle in case in a hospital. But if it is in a COVID situation, that becomes really, really difficult because all other things we have to take care. The man force, the manpower, the available doctors, nurses, nursing staff, and support staff is less than the required strength, and it's very difficult to really take care of those things in a COVID situation. Next, please. Situation in case of fire is very, very difficult, as I told you, because if the things are planned in advance, then it is difficult. But things do not go as per plan normally, and it is very difficult unless we have thought of something in the beginning itself when we are starting that facility. And we know that electrical equipments, they are used in every hospital, especially in COVID situation, they are little, maybe more in number. And then if something goes wrong in any of the electrical equipment, that is the biggest problem, beginning of the problem. And we have seen that more than two-thirds of the incidents of fire are related to electrical origin. So maybe short circuiting, overloading, faulty equipment, or anything may be connected to electricity. That being the reason. And second thing is that whenever there's an electrical fire, that results into a very heavy smoke suddenly. So that is the main reason. So we are talking about infection, things not transmitting from one cabin to other. So here, if there is a smoke due to this, then it's going to spread to whole of the, it's not going to, the blast walls are not going to stop it. It will go to whole of the big hall we are having these facilities. So that is the area I'm really concerned, because we have seen that people be getting killed because of the smoke alone, and they cannot get out, they can't see, it becomes the biggest problem. So whenever we are planning anything, have we catered to this requirement of the smoke venting or management in case there is a fire in that area? I think that is normally we are not giving that much attention. We can see our hospitals and our facilities. I think we'll find that we are not really looking in that seriousness to these areas. We have seen that, in fact, in some of the Gujarat fire, we have seen some of the videos, in the CCTV footage, and we saw in that footage, we saw that within one of the equipment got fire, and within about immediately people started reacting, the hospital, the staff present there. But within about a minute or so, 1.5 minutes, situation was so that it was difficult to really get out of the room. Now, when we got hardly 2 or 3 minutes, not even that much, in case of a fire in electrical equipment, then we have to plan for that sort of a situation. And that we cannot plan anything more than that. I mean, getting out is not possible because of the patients are in that situation. But only thing is smoke management I'm talking about, smoke venting and management. And this cannot be achieved unless we planned in the beginning. We have got proper facility for that. Next, please. Now, this is some of the we had many incidents in Gujarat itself. We had in one small in Delhi also. So we had in Gujarat about in about 3 months' time. So 5 out of 11 patients died in ICU in 27 November in Rajkot. Then we had some COVID this in Ahmedabad situation, 3rd October. There, patients were at risk and they were evacuated. There were 19 of them were taken out. Surendra Nagar again, there was a fire where 8 patients were on September 29th. And most of them, because of the same, when the smoke conditions were so difficult in few minutes that they could not really do much. And then same way, again, Udaipur also, so many people were trapped and they were just taken out. Next, please. Jamnagar, we had a fire in near one ECG room. And then on 5th August, and then machine caught fire and probably 9 patients were shifted. Himatnagar, then again, Sabarkantha in Gujarat, one mother and child, they died in the particular fire incident on 26th August. So the fire was in this electrical fire operation theatre of recovery room located in 3rd floor of our Cygnus Hospital. That's what doctor they were mentioning. So there, in fact, a fire was there, smoke was there. So fire brigade was called. So I got a report from the fire department saying that before they could reach the place, the people were taken out, and about 18, 19 of them, they were taken out from there. So that being the reason, I mean, if we are able to react and take out the people, and it is so difficult it is to take out the people who are on life support system, and in that situation, it is just impossible. Saying is okay, you can say that, but it's not feasible really to do that. Next, please. Now, this is a fact. Facts we must know about the fire incident. 2/3 of the total electrical fire incidents are caused due to electricity. So we have to be seeing that all the electrical fitting, joints, material, equipments, meter, cable, everything has to be perfect, intact, and there'll be no sort of a fault, possibility of fault, and creating a problem for us. Rubber PVC material, they just create another problem because smoke is too thick and heavy, and it makes our problems more difficult. Suffocation, poor visibility, everything is there. So we can't avoid it because electrical equipment, they do have these things. So because this we cannot avoid, so the smoke venting facility, we have to think of, and we have to create something for that. Maybe a simple exhaust fan may be good enough in every cabin in that sense. So, but then A provision has to be made. We cannot do without it. Smoke can spread horizontally or vertically. Now the building facilities, they like you have got shafts, electrical shafts, sanitary shafts, so many other shafts, firefighting shafts. So vertical opening, there can be a problem. A horizontal opening in the walls for passing of the cables, that can be a problem. And we have seen that our doctors has shown some of the footage from the AMRI hospital. I mean, that was there and 93 people died. Fire was in basement and smoke spread to the upper floors. So if the things were controlled, I mean, design of the building was such, things should not have spread to the upper floor, probably so many deaths would not have taken place. Now, either firefighting was delayed or it was not possible to control the fire. So many other factors are there. But main factor is smoke spread to rest of the building. If that was controlled, things would not have been that difficult. So that stands in a COVID hospital as well as non-COVID hospital. Next, please. Now, again, continuing that, smoke-free unlocked means of escape, that availability of the well illuminated. Now, this is what is required in a building because fire can occur in daytime, nighttime, anytime. So now we have to have properly, design the means of escape facility, which are smoke-free also. And for that, we have to have required facilities there. They have to be illuminated wide enough, and they should be placed strategically on not only one side, that you may be an alternate staircase also. Now, people are not used to walking in smoke. That is, we have seen in our incident, 1997, where 59 people died over there. So they all were able-bodied people, but they could not get out because that they were not used to walk into smoke and really go through there. So are everybody in a hospital. So patients, I mean, we can't expect anything to be done by them, but we have to support them. And how many people are available there? So in a hospital situation, these things are very, very difficult, and we have to plan in advance. So proper training to the doctors, nursing staff, assistants, everybody available there, and knowing about everything in that hospital, where electrical switches, main switch, if you switch off the mains, probably electrical fire can be controlled to a great extent. Then you need to take care of maybe by throwing water, you can do it, but extinguishers you can use. But so long as power supply is continuing to that equipment, it will be difficult to control the fire, even by using the CO2 or powder or whatever it is, because the smoke and heat will be there so long as contacts are there in that equipment. Next, please. Now, safety with respect to electrical system, I mentioned that earth leakage circuit breaker, MCB, the miniature circuit breakers. Now, for these to function, I was attending some of the other seminar and probably somewhere, and the electrical people, they mentioned that the quality of the electrical wires, copper wires, conductors, if they are not having the proper, resistance is a little more than required, proper grade copper wires are not there, the systems do not work. So we have to even see from that angle that our systems are provided, but are they going to work in case there is a problem there? So we have to ensure that particular aspect also. And automatic fire dampers in the AC ducts, that is also very much necessary. Now, Dr. Sab was showing me, Jugal Kishore was showing that glass cabin for the viewer viewing by the staff, family members. Now, I could see that we have got AC duct supply on the ceiling. Now, if the same AC duct is connected to this all, then the separation from the glass will not be, because if AC is working, then everything becomes useless. So we have to see from that angle that such areas we have to have independent AC air handling unit, so that there is no mix up at the duct level and all that. So proper dampers and other things become necessary for that. Location of electrical main switches is again a problem. We should know everything. Then we have that proper provision of smoke venting, that I mentioned, because for centrally air conditioned building, and Dr. showed one or two the modern hospitals. Now, I am more worried on this modern hospital with having the glass facade buildings. They do not have any windows, openable windows, and I don't think they do take care of the smoke venting in that situation, so that it is effective smoke management. So I'm really worried on that count that buildings are coming up, but that smoke management or smoke venting is not given that importance, which is the most important factor so far as saving life is concerned. And then this AIMS, I was there during my service 2007. I had a fire incident in AIMS When you enter the gate on the left side, there is a single story, the basement structure there. There was a fire in the UPS, and it took about 2 hours to locate the seat of fire. Fire was in UPS in one of the corner, the far end corner of the building. So, and we didn't have any smoke management. We could not take out the smoke because that is not catered to. The building is central air sea, but it is not having the smoke venting system in case of fire. So that's what I want to convey, that we are taking care of everything, fire alarm, this and that, but not really the system. Next slide, please. I think 1 or 2 more slides. Sure. The hospital occupancy, this is an institutional building in the NBC Part 4, and everything is given there. I mean, one can have a look at that. So that what is the number of staircases, width of staircases, and how we really segregate them. Fire alarm system, it's one of the requirement, but it can give you an alarm, but then we have to react. So people have to be available to react to it and take care of the firefighting and evacuation, whatever is there. Wet riser, hose reel. I mean, hose reel is one of the things which all our hospital staff, they must be aware of and how to use it, because that is the first thing they can do in case of small fires. So awareness and about these facilities is a must for the hospital people, and some training has to be there for that. Automatic sprinkler is one of the best thing which can take care of the firefighting. We have, I mean, wherever the system is provided, we have seen that 93% in our European countries and maybe US, and there we have got its success is 93%, 97% fire is kept under control. It did not go out of the room where it started. So if the system is provided, I think then we can be sure that fire is not going to go out of that premises where it starts. Next, please. Thanks. Last slide. Need for built-in. We have to have all built-in facilities only. We cannot think of anything fire brigade coming to you, the tall ladders they are having. These will not be useful because they are useful in only certain circumstances. At the time which we have 2 or 3 minutes for life safety, we have to be having inbuilt facilities, and we cannot depend on the external facilities for that purpose. Next, please. So the performing rescue and firefighting in COVID situation, only thing I want to convey here is that since it is difficult, even the normal situation, in COVID situation, we have to be dealing with so many other things. And we have got sanitizer bottles, maybe alcohol thing is there, oxygen charge atmosphere because people are being given oxygen there. So these become more, add to the hazard. In case something goes wrong, the things will be burning very fast. And then normal upkeep maintenance is affected because we have got 50% staff coming for that. So that's again a problem. And it's a problem for the firemen responding to that because many of the fire department in different cities, they don't have even breathing apparatus sets, and they don't even have, in fact, normal, maybe you do a mask, but then we get some extra protection like Delhi Fire Service. They've got a helmet, PP, they've got PPVs, protecting clothing, which is normally having a helmet with a visor and a glass separate goggles. And below that, we wear the normal mask. And that gives the proper coverage to the neck and all that, so that nothing goes out or in through there. So that is, Delhi Fire Service has made a sort of a protocol, has issued that only few number of people will go for rescue and firefighting, and they will be wearing these things and overall combination, so that they come back and they just put everything for washing and replace everything for the next incident. Next, please. Conclusion is that rescue of the people in who need life support, who are on life support system, is very difficult. So possibility of evacuation is again very difficult. So we have to think in terms of possible of lateral shifting. On the same floor, we have to divide the hospital floor in a manner that you shift them to other side of the building and with a segregated properly with a fire door and maybe wall in between. So something like that. It has to be designed in the beginning. We cannot think when fire is there. So this is very much required in case we want to shift patient from one side to other or during the duration of the fire. And prevention of the fire is the most important. So everybody must know that they should not create a fire. They should take care of all the facilities inside and avoid the fire incidents. Need of fire alarm, fire suppression, smoke free means of escape, that is very much necessary. So we should know about it and they should be kept available in good working order. Training and awareness, fire drills for the doctors and people available there, that's a must. And availability of trained fire officer if it is there. In the national building codes, there's all hospitals, high-rise building, they must have a fire officer. And around the clock, people should be there who can respond in case there is a problem. I think that's what I could present in this short time. Thank you very much. I think this was the last slide.
Thank you very much, sir. I think always focus So he experiencing all that important will be hit him on this. So with this, I
Okay.
on fire safety.
Please go to Dr. Ajay Behel. Behel Saab is there.
Yes,
Let me just introduce Behel sir. So, Professor He's also a professor in orthopedic surgery.
वेबिनार मेरे लिए करा रहे
is a
नहीं
देखिए वो दिख क्यों नहीं रहा मैंने पार्टिसिपेंट देखा उसमें
several other masters in business administration. His area of interest goes into emergency, trauma, disasters, elderly care software. He has his book published in Basics in Biomechanics for Doctor Hospital. With this, he has several awards in his name, such as Delhi State Award for Medical Service in recognition of 25 years of medical service at loss. And I think this will go long and long. So with this, I think I welcome you for this session on the topic of safety of patients and health.
Good afternoon. Yeah, I'm so happy and delighted to be among you. Many thanks, Major General Manoj Kumar Bindal, Mr. Amit Khan, who had always been there, and he has doing so many webinars on the topic. And he's a very praiseworthy person, and all this credit goes on to him. Then my friend R.C. Sharma ji and Google Kishore, they are there. So happy I'm there. And we have a Professor Kausal also with us, so that's so lovely. I'll be talking about common things, which we are all aware of it. Now in the COVID times, I know, we had to care for ourselves along with our colleagues plus your patients. And you have to run together basically. And we all know in detail what is a coronavirus. Coronavirus is an RNA virus. I'm just telling you basic facts. And we will build our things onto that. It can cause mild illness and severe illness also. MERS and SARS, we are quite aware of it. They are the bad forms of the disease. And this disease spread from Wuhan, a small place in China, seafood market. And from there, it has spread all over the world. And now it's very difficult to control. This pandemic has involved practically everything. Everything is coming onto disasters, starting with various spheres of life. They're all going back and back. Okay, so let me share my slides also. Yeah? So for the slides, yeah. Can we open it? It comes down. Can you see
sir,
the slides?
you have the no sir. You have the presenter, right? Just go to share and share your file and the screen and it will come, sir.
Right. Okay. Can you see
Yes,
those
it's
slides
coming
now?
up.
Yeah, right. So our main concern is safety of ourselves and the patients who are working with it. In our times, in the COVID times, main focus. And we know this thing about that. The disease has been in the seafood market in the Wuhan and spread all over the world. And this slide is very, very important. It will tell you how the virus spreads from one person to another. Suppose there is an infected person. He coughs, sneezes, and talks loudly. Small droplets of virus, they're thrown in the atmosphere. And they are bigger sizes, more than 5 micron, they're bound to settle down. They're bound to settle down. If a person is in the vicinity of a person, he'll get the disease. If he's short of 1 meter, he'll get the disease. And if all the inanimate things where the droplets have fallen and this person touches that thing, is bound to get the disease. Very important facet comes down. There are certain droplets, which we say droplet nuclei, less than 5 micron. They are suspended in the air, and they'll be suspended in the air for about 15 to about 1 hour. And they can travel far distance, more than 1 meter. That's why it is advocated that people have to wear the mask when they are out of the home. And another important thing which comes down is, what is the survival time of these droplets virus? People are saying on the porous surfaces, it is about 8 to 12 hours only. And when we talk about non-porous, it is 1 to 2 days. And stainless steel, etc., is far, far greater. And how does the patient comes down? It generally comes down to simple things like cough, fever, malaise, and sometimes pain in the chest and shortness of breath. They are the symptoms which are really grievous, and one has to put a focus onto it. And later on, he can have renal failure, pneumonia, and other things will come down. At risk of most infection, the people who care or come in close contact with the COVID patient. This is an important facet. And tracking, which is occurring all over the globe, what we see in India now, a little downward trend is seen, and in Delhi it is definitely down for the last 14 days. But remember, a few weeks back it was huge, about 150 deaths in the city. So you have to be always cautious. We have the winter seasons. Of course, the vaccination might come or may not come, but winter season is there. We have to be very careful. And if the things turn out to be smooth, we'll be all away from this with the help of the vaccination. Yeah. We are talking about health workers. Can you notice in the WHO reported series, 14% of the COVID-19 cases were healthcare workers. And in some third countries, it's 30%. Huge number. And thousands of healthcare workers have died because of the coronavirus. These things are very significant. And one more dictum, which we all know, since Hippocrates' oath, that we have to do nothing wrong. First, do no harm. You may do a good thing or not, but a patient should be not harmed at all. So we have to build on that strategies and try to build up a hospital or a healthcare workers in such a way that they are not causing a spread of the infection. Okay. And when we talk about the patient safety and health workers, they are two sides of the same coin. When you care for the patient safety, inherently we are caring for the health worker safety. And if you care for the health worker safety, you are caring for the patient safety. They are just interlinked. You have to support it. Motivated health workers to provide the safe patient care. Okay. Then no country, hospital, or clinic can keep its patients safe unless it keeps the health workers safe. Yeah, you may have noticed, we have the Babu Jagjivanram Hospital. There were over 88 healthcare people who were infected and the hospital needed to be closed. In Surat also it happened, many healthcare workers. So you have to have their sanity, their infection rate should be as low as possible. We'll talk how we can do it. Yeah, this should not happen. This is incidents in Indore. See how the people are throwing stones at the doctors will come down to help them, suspecting they to be the COVID patients. Very bad, very bad. Laws are the things cannot hurt. You have to be aware. People have to be educated. They have to know the transmission of disease. They have to know how the disease can be halted. Then the people, the doctors and nurses who are working in the hospital, they're working for long hours. Can you imagine the PPEs which they put plastic like apron? People cannot take food, cannot drink water, not go to the washroom also. This is the state, and they have to work for 12 hours in a shift. Can you imagine how bad it is or how tough it is? Then they are treating the patients and they cannot go home, especially if we have elderly people at home. Otherwise, they'll be transmitting the disease to the elderly population, comorbid conditions. They have to work in those scenarios. Therefore, there has to be a lot of mental anguish, mental health distortions, and psychological aberration. So you require a very nice policies which has to be drafted to have proportionate or duration deployment, working hours, and enough rest. And you have to get these workers tested after a certain time. And you have to provide insurance coverage for the work-related risks which they are endangering. And you have to have the social and the psychological support, maybe through online support and other things, okay? Then they have to be concerned about the physical and biological. If few person are working, they have to do a lot of work. So physical injuries do occur. We have to take care of that. Then we have to know that PPEs, they have to be in good quality. They have to be enough amounts, and you have to have N95 respirators and powered air purifying respirators. In operating theater, we're using those gadgets also. They should be enough quantity. And then only you can save the healthcare workers and inherently are saving the patient safety. Okay. Then what happens is, as we know the disease, we have 2-3 types how we can label mild symptoms, severe symptoms, and very critically things. So mild symptoms should not come to the hospital. Otherwise, what you will be doing, you will be just flooding the hospitals with the patients. So some scenario, some ways has to be built up. Some referral system should come down in the place. So they have to be curtailed at the local things. So how we do it? In the mild cases, we can put it into the guest houses, hotels, or some isolation places. They are centers, COVID centers. Then moderate cases, we put it up in the COVID hospitals or dedicated blocks in non-COVID hospitals. They are caring for the severe illnesses, ICU facilities. ECMO is something when you take the blood of the patient goes out and you do a refining, it comes back in the body. And you do an oxygenation outside the body. So they have these gadgets, dialysis, they have to be in the tertiary at the bigger hospital. And there too should be good referral centers. And telemedicine has a big role. Patients can always talk to the doctor, they on to the hotlines, they can call, say whether they should come down the hospital and what is the need. And we, on the other hand, could say there's some things which can be treated at home, let them be treated there. We can tell them the treatment protocols, how best to get rid of them. And mass media has to help in that. They have to generate the things. They have to tell the people that we have a hotline, sign and symptoms, and what treatment is required. In a hospital, we have built something. The patient relative can come, he can talk through the video with the patient and they can allay the anxiety. If the patient's all alone, without the relatives, and they're always thinking of the disease, you can understand the psychological, social things occurring to the patient. So we have to eliminate that. Small thing, visual alerts, they are a must. Most of us know that, how to wash our hands and how to have things, bend the elbow and sneeze onto it, these small things, and how to discard all these things into a container which has the lid. Very important things, but often forgotten. We have to wash our hands very frequently. 20 seconds should take place, soap and water. If that is not available, you are outside somewhere, take alcoholic things and you can wash your hands with sanitizers. Alcoholic containing 70% the alcohol. Okay. Then at the entry, you have to have air locking systems. They are able to keep the pressure inside and will have less pollution, less COVID interactions, and you have to have a thermometer system also. As soon as the patient comes down, we know that he's having fever. He may be having COVID symptoms. You have to be careful. Air curtains, which we have used in the fire also, they are setting a partition between the outside and inside the hospital. And very important thing is, during this COVID times, other patients with cardiac ailments, other patients with cancer, they are being neglected. Some provision has to be done, and things are being done. that we have a non-COVID portion also, where the patient can walk with safety, get the treatment and out, while maintaining other essential medical services in the community, both during and after the epidemic is very important. COVID, naturally, we are doing it. We are having COVID designated hospitals. They are looking for it. But other people, they are often neglected. Then triage system has to be there. As soon as the patient comes down, this social triaging has to be done. And in the village side, you can imagine, in the village also you can do this social distancing. Then what has to be done? You have to prevent the overcrowding, have rapid triage, and basically in the triage areas, you should give them enough space, enough distancing with the people, let them have the gadgets, masks they should wear, they should wash their hands, be careful, and how to move from one place to another. It should be unidirectional movement. And if that is there, the things are easily done. And respiratory waiting room, the patients, see how much good hall is. It's very clean that way, open to the exterior, well ventilated, sunlight can come down. If you can build up these things, they are best. And they too should have a dedicated restrooms, hand washing stations, and naturally all these things, and information has to be given to those patients. Some clear signs informing the location of these things. And this is a triage which is usually followed. Very simple way we can do respiration, we can look into it, we can look about the circulation and then the conscious level, and depending on that, we can say which patient is more serious and which is less serious. And this is the typical thing which we do it. What things are done? We look into fever, we look into the pulse of the patient, we look for the respiratory rate of the patient. We have nowadays SpO2 monitor. You might have seen small probes being put on the finger. These types of probes are put on the finger and we find the reading. And if we find it more than 93 and 94, we are very happy. If it is less, it means patient has to go to the COVID designated hospital. Otherwise, COVID centers. Very clear? And if the SpO2 levels fall below 90, BP falls below 90, they have to go to the ICU. This has to be clear. Early treatment, you can save many, many lives. In the patient safety, early venturing, early treatment is the hallmark of success. So you have to all work for it. Okay. Then we have to have a good planning, OPD planning also, where to triage those patients, where to get the screening, and have a uniflow of the patients, and how to care for the respiratory care patients, and provide all the sanitary things, precautions, and gadgets, masks to the patients. They have to be free of cost. They have to be free of the cost. Then indoor patients, they have to be also cared. You have to have good ventilation, good natural lighting if that is possible. And very important thing is have negative pressure rooms. Negative pressure rooms. If you have that thing, we don't cause cross infection. We don't cause infection in the patients. So we have to have ICUs, number of beds for that, ventilators, critical care management, ECMO facilities. They are a must when we think of hospital care. And this is the way simple. See, what we have done is we have just put the patient far off, about 2 meters distance between the beds. So we have made them safer and provided all the gadgets to those people. And remember, patient has to be transported from one place to another. So how he has to be carried, this is important. All that movement, first the movement should be minimized. And if he has to be moved, give him a mask, disinfect the areas, and sanitize his hands, and have an ambulance with appropriate PPEs, and let them move on to the ambulance to that area, which should be disinfected before the patient arrives. If you can build up this area, scenarios, so naturally, you will not cause patients cross-infection. Prevention and control practices, they are very important. Restrict the visitors and the movement within the facilities. Provide triple-layer surgical masks to the visitors who come down. Have a provision of hand sanitizers in enough quantity. Soaps, water. These basic things are sometimes also lagging. Perform regular environmental cleaning and disinfection. Maintain good ventilation. Open the doors and windows. They'll help you a lot. And this 100% surface contact, certain machines are there. They'll throw the disinfectant and clean the area. And this thing is very important. They are powered air purifying respirators. During operations, you can use them and be happier. You will not get infection. If you don't get infection, you will not spread the infection to other people. And there are certain conditions when we have the aerosols. Aerosols means when we open the abdomen of the patient, all the blood comes out. You can have virus coming out from the mouth also, they can come out. So you have to build in such a way that you are well protected. If you're well protected, you can do further operations and carry ahead with the amelioration of those masses. Well, implement the national programs for occupational health and safety. When we talk about the national occupational health and safety of healthcare workers is a must. Plan that. Have the congregation of the peoples from various disciplines. Try to build up a good plan. Have standards, guides, and codes so they'll be able to control the disease. Okay. Then another important thing is many people might be dying onto this area. You have to prevent. You have to prevent the infection from the dead bodies also. But respect the dead body. They are the mobile morgues. They can have about 30 to 40 dead bodies onto this area. And give them a proper grief time also. Until unless you give them a grief time, they'll be suffering from post-traumatic stress syndrome. So try to safeguard against them. Let the son see his father, father see the son. So if that is there, they can have a grief-free period, and after that, they'll come down to normal. It may take about 6 months or 2 years, but then they can come back to normal. So these are essential things. And very important slide, this is a very important slide. What the various countries have done, if you go for voluntary social distancing, which was done by the states, America, so you had a lot of spread of the virus. And if it was an enforced lockdown by the China, you were able to control the things. The red people, they are the infected one, and blue, they are normal. If these red people don't curtail onto the premises, come out for the occupation, for the job, or some other work, so they are parties, gatherings, so they are bound to spread the infection. If you curtail their movements, after some time, after 14 days, they'll also be out of the infection. Very important thing. And forced lockdown has to be there. And naturally, vaccination, we are all happy. We have all smiles on our faces. We are getting vaccines. Pfizer has come down with that. And UK people, they're getting onto it. And they are so good. They put the first one into a lady, 90 years old. But many problems may come down. You have to be guarded. Effectiveness of the vaccine, 27%, 87%, huge range. You have to adopt a vaccine which is far greater safeness and have safety profile also. Reactions which occur should be bare minimum. The cost is also important. It should be less cost so that each and everybody can get the vaccine. And we have to cover a huge area. So we have to decide the priority, how we can move from one phase to another, how we'll try to cover up, and we'll cover and give total immunization. But remember, these viruses are very intelligent. They have a shift and drift policy. Their genetic framework changes. So next year, these vaccines will not help. You have to develop new vaccines. So all these things, if we take in a holistic approach, we should be able to give good safety to our patients and to the healthcare workers who are caring for our patients. So both things are the same when you talk into other ways. Okay? Yeah. Very important thing is, during this COVID time, balanced approach is very important. You have to treat both COVID and non-COVID. Don't neglect the non-COVID, otherwise the mortality will arise. People are talked about pandemics along with other cyclones, etc. Here also we have accidents, and we know the patient is COVID. We have mass accidents, 5, 6, or 10 people coming down in trauma centers. They're all with serious injuries and few people, the COVID, and they have the reports with it. What has to be done? We'll care for each and every person. We have to treat as if each and every person who comes down is having COVID. We should not panic and not be complacent also. Healthcare being a core issue. So healthcare well-being is a core issue. Let's care about healthcare workers. If we are able to provide him the services we require, we can care about his elderly parents, his children, so naturally they can put more hours in the hospital. This is another approach which is done at certain countries. The health and safety education of masses, we have to make people educated. Unless they are educated, see how the mask is worn. Sometimes nose is covered, sometimes mouth is covered, sometimes both is not covered, only the chin is covered, which is not required. The T-zone is, this is the T-zone. T-zone, both eyes, nose and mouth. If you are able to curtail that thing, you are able to hide that thing, unable to keep it away from the virus, you will not have a COVID. And keep on washing the hands. The touch or contact will also not occur. And you have to look after the elderly people with comorbidity. If you're able to look out, your mortality is bound to decrease. We won't have much of this. Follow guidelines issued by the government. We have to set protocols. Each and every person need to follow that thing. And very important, stay at home. As we are staying at home and we're taking part in virtual things, virtual webinars, and we are safe, and we have to think positively. Everything is okay, and things will all settle down, and we'll be again back in the pre-COVID period, and we'll be all mingling together, running together, and doing all the activities which we were happy at doing. Okay, thank you, everybody. Thanks.
You sir.
Thanks. If there's any question. Yeah.
So,
Thank you.
so I say that.
Oh, yeah, right.
Okay, sir.
Okay.
So, sir, can
You hear me?
Bell Saab, you have to stop your presentation.
Yeah, वही मैं देख रहा था. Where is that icon?
इसको ऊपर ले जाइएगा अपने कर्सर को.
Would you want to see the changes to take? I think that's okay. I think.
Yeah.
Yes, sir.
Yeah. Thank you. Okay. Thanks.
Can you please tell me?
Kausar Saab, are you there?
Yeah, I'm right here, but are you able to hear?
So your voice is very low.
So your voice is very low. Can you come closer to your speaker?
Can you hear me?
No, we can hear, but it's a very, very little sound. So you have to.
Okay.
Please go ahead.
Okay. So
He has work experience towards developing, managing, and continuously improving healthcare systems of the highest quality, acceptable, effective, and efficient for patients. His education includes master's in nutrition processing, and now as a so he has published more than 10 scientific research journals and he has been awarded first prize in the 2017 International for his study on scientific and He's also a member of the Academy of IDM. Welcome, Kaushal sir, for your turn.
Thank you so much.
Yogita, give me the sharing rights.
Kaushal sir, please, if you can be a little loud.
Yeah, can you hear me now?
Yes, sir, we can hear you, but it is clear, sir.
Thank you so much for such an elaborative out.
You have to bring mic close to you. Mic is little away, I think.
Yeah, it is very close to me, sir. I think some issue with internet.
Okay, no problem.
So first of all, I would like to thank Dr. for giving the opportunity and share the panel with such team, and glorious faculty. I think my topic actually covers most of the things that have already been covered in the past, and there is overlap. Hence, presentation focuses on the same plan.
Dr. Kauser, you have to slightly skip those parts which have already been covered.
Yeah, I will make sure. I will.
Please, because we are definitely running late due to that late start.
If you want, I can finish it in 5 minutes.
No. It's not the thing. We want to listen to you, but definitely those portions which has already been covered need to be.
So I think I will straight away go to the first slide. Please change it. Yeah. First of all, why do we need a safety plan? Entire community up the hospital during the pandemic. The whole to fulfill their entire gamut of where we are there to application of one cases. The hospitals carry out for treatment to the for providing treatment to such COVID-19 cases, and at the same time, the hospital has to strive to provide routine health services to other types of patients like trauma, cancer patients, emergencies. At the same time, they must show that they are not hotspots for the spreading of infection, like the panelists have already highlighted. So at the same time, whatever information is being generated at the hospital, they communicate it to the relevant authorities so that helps in containing and mitigating the overall pandemic. Most of these things have been covered, so I'll just run through it. Them. First and foremost thing is that we must understand the disease itself and what will be the scope of the services of the hospital that you and what are the infrastructures related requirement for infection control which will be development of clinical management protocol, and availability of medicine, disinfectant, other that are required for patient. Essential and important part is about the management of stress and anxiety among the healthcare. Then next slide please. Human resource management. Yeah, next slide. Yeah, next slide please. Human resource management, continuing treatment of other illness, biomedical waste management.
Hello, Kausa sir, we can't hear you. Your voice is breaking, sir. Hello. Sir, your voice is breaking. Unable to hear you. You might want to log out from your attendee session so maybe the connectivity will get better. Sir, it's already unmuted. It's showing already unmuted.
Yeah. Now am I audible?
Yes, sir. Yes, sir. Please continue.
Yeah. Yes, so the foremost responsibility, the first problem that we face is the understanding of the disease and its spread. So primarily we have to like rely on agencies like WHO, ICMR, or Ministry of Health and Family Welfare to know what is the exact clinical presentation and how we define a case, like whether it is a suspected, probable case or confirmed case, and the diagnostic criteria. Right, please. Yeah, next slide, please. Since hospital is part of an entire system of health services where multiple agencies are involved, the role actually has to be crystal clear. And this depends basically on the existing infrastructure that you have in the hospital, the scalability of operation, and upgradability to handle such a huge infectious disease patient load. So the hospital administration should guide the policymakers because they are because policymakers don't know what to do and where to take care of the patient. So the hospital administrators must ensure that the correct information about the handling capacity of the hospital, the type of patients that can be received. For example, we had a National Cancer Institute that came up in Jhajjar, Haryana, and it was a lean clinical staffing where we were managing only few patients. And at that time, we were asked to take in serious patients. So since we were not adequately staffed, appropriately staffed, we had to restrict the intake of patients as those who were very stable and they were not expected to deteriorate. Next slide. Next slide.
Amit sir, can you hear us? Next slide, please. Kausa sir, I think he has some issues with the system. Amit sir, can you change the slide? Okay, sir. So his system has been shut down. So he will take, I think, few more minutes to join with us. So, Kausa sir, if you can continue. Please continue.
I can continue.
Yes, sir. Yes, sir. That I think would be better.
So once we have specified what is the role or the scope of the services that the hospital will provide, we must understand the basic requirements of starting a facility. One of the panelists just spoke about converting existing facilities into makeshift hospitals. So under such circumstances, we must ensure that there is a continuous and safe water supply, and there are appropriate cleaning practices in place. Then there is adequate floor space for the beds, appropriate hand washing facilities, adequate ventilation, and adequate isolation facilities for airborne, droplet, contact isolation, and protective environment. So once we have finalized, like suppose we have decided that we are going to take very serious or critical patients, so we have to build the capacity of the hospital in the terms of the equipment, the manpower, because patients in septic shock would require vasopressors. You'll be needing some bedside surgical procedures. Then those with ARDS would require mechanical ventilation, so you would need ventilators and high flow nasal oxygen infusions. And those on acute kidney injury would require dialysis. So the hospital must build on its capacity. And in terms of the oxygen requirements, very critical, because generally we give oxygen in the range of 4 to 6 liters per minute. And for some patients, we have to give like in the range of 40 to 60 liters per minute. So the hospitals have to keep a backup of cylinders. Then maybe if they are depending on liquid oxygen tanks, they might have to go for enhanced capacity of or additional tanks for the same. So I have presented here a list of equipment that need to be kept ICU and emergency area and an award. So just let me tell you about what you need in an ICU. You would need defibrillator with leads, portable ventilators, syringe pump with leads, cardiac monitors, then shift portable monitors, rebreathing masks, ICU bags, laryngoscopes, oxygen cylinders, backups, DP pumps, IV helmet, video laryngoscopy with blade to prevent aerosol-induced like infections. I would bring your focus onto the infrastructure, that means the infection control. See, you can't just convert the entire hospital to a COVID facility because you need to cater to other types of patients. So if you have multiple blocks, you can dedicate one of those blocks as a COVID hospital. Or in case you have to restrict, like if you have to adjust that into the main hospital, then you can do segregation in one of the floors as COVID floors. Within the floor also you need to have segregation. If you can see this figure, on the left side you have like 3 color zones we have. You can see the green is the clean zone. The darker orange or yellowish portion, the crimson yellow is the dirty or contaminated areas. And the yellow one, you see these are intermediate zones. So dividing or zoning your COVID facility is very important. These are not just physical barriers, these are also air barriers. You see the ventilation of the patient care areas is separate. You have separate air handles for them. I'll talk in detail about what are the various ventilatory requirements, but otherwise also you need to segregate your area so that you can ensure that your staff is well protected from the virus itself. So not only that, there are like to shift from one zone to the other. Like if you see you have a donning area, you wear your PPE, wear your goggles, masks, and your helmets and everything. And then you enter into those COVID areas. And before coming out, you doff off. You can see the extreme right, you have to doff off and you come to intermediate areas where you can have showers, change your clothes, and then go back to the clean area. So if you see, you have lifts dedicated for patient areas, contaminated regions. So if you have a stacked planning of the hospital, so you are able to see that your lifts, some of those would be dirty lifts or the contaminated lifts. The staff, for staff movement, will have the clean or not the non-dirty or the clean area lift. And coming on to the next slide. Convert your existing facility into isolation facility. Somebody talked about the risk assessments and proactively converting hospitals or planning facilities that are well ready to handle COVID-19 like illnesses. See, as a general recommendation in a general or a super specialty hospitals, you almost 10% to 20% of the beds which are dedicated in isolation beds. And that too, that would include both positive and negative types of isolation. So what we saw in COVID times is that entire hospitals and the communities overwhelmed with the patient loads. So whatever you might have planned or risk assessment may have been done, you will not have 100% of even 50% of beds converted to isolation facility. And suppose you convert those facilities into isolation facility, you will not be able to cater to the rest of the other illnesses types of patients. So despite everything, we might have to go for retrofitting, and that is what I have suggested here. So you should have separate contaminated and clean areas. Negative pressure, as sir already talked about, the minimum differential should be 2.5 pascals and preferably 5 pascals. And it should have 100% fresh air inputs with independent exhaust blowers, and those exhausted air should also be having HEPA filters at the air extraction points. And since the hospital staff would be donned and airs put on, they would need appropriate temperature and humidity controls, and at least 12 air changes per hour. So coming on to development of clinical management protocols. The next slide, please. Since the safety plan, actually it is a plan, so we must know how to develop, or it is about strategizing about development of plans. So I'll be mostly focusing on the strategies that you should focus on. So to develop clinical management protocols, you need to have at least a COVID task force, which actually searches the various researches, communicates with the ministry and ICMR to get an update on the treatment or the and the testing protocols. So they should check all the research also. Then accordingly, they define what is the case, what is the diagnostic criteria, how do you basically grade them, and where exactly keep them, develop a admission discharge criteria, then specify the level of setting, monitoring, and people. So ventilator versus high flow oxygen, we saw that those on ventilators, we saw that patients who were kept on ventilators, they had higher mortality compared to those when they fell short of ventilators, they could finally patients because they could only give high flow nasal oxygen. So basically, these treatment modalities are also evolving, so they have to keep abreast with the latest development. Coming to the next slide, after you've developed your clinical management protocols, you should develop certain SOPs. These are that I have highlighted, but these are not exhaustive. You have to develop more of those SOPs based on the existing protocols at your hospital. So at the least, you should have registration, admission, transfer, and discharge criteria well laid down. How you will collect a sample, what is the methodology of the disposing of the biomedical waste, and how the donning and doffing of PPEs will be done. Cleaning and disinfections are already talked about that, and how to pack those dead bodies. Coming on to the next major risk that we have is the infection, spread of infection within the hospital, among the patients and among the staff. So I have, since this is a safety plan for COVID, so this is one of the most essential things that we must focus on, because you need to have workforce that is healthy to patients. So as part of prevention control, the better that you identify cases first, that should be fast, ensuring the recognition and source control, and you isolate patients with suspected COVID-19, apply standard precautions and additional precautions, and have to implement certain administrative controls apart from the environmental and engineering. Have to, coming to the next slide, if you can see, to have enhanced surveillance. Suppose one of your staff comes positive, so there should be a mechanism of identifying who are the close contacts. So we do a contact tracing, we go for home isolations, we go for testing, and once they are okay, then they are again joined back. If you have like samples traveling across your institute, you have certain non-COVID areas, you don't want to expose all your lab staff like exposed to COVID-19 virus, the coronavirus. So you should have point of care testing services, and you can sampling. We'll talk about that in detail later on. Then you have to know like what are the specific specialized lab tests that must be done. These will be like followed as per the ICMR or MHA guidelines. Then the vaccination campaigns are evolving. So we will wait until we have a successful vaccine. Mass prophylaxis, you must have heard of hydroxychloroquine, azithromycin, like it was like, despite several side effects, this was distributed to all the patient care areas and all the staff who did not have risk factors for like taking those medications, but like given those medications. Then coming on to the sampling part, next slide please. So I think this has been dealt with, so I just skipped the PP and like specimen transport. We can just see what is the specimen transport. In the specimen transport, must ensure like we used to have a triple protection for that. So in this I have mentioned only two because two is mandatory. You have to have leak-proof specimen bag, which is the secondary container, which contains the separate sealable pocket for the specimen, which is a plastic biohazard specimen bag, can be a zipped pouch also. And you should not use pneumatic tube systems. Coming to the next slide, sir has already talked about the 1 meter distance, environmental cleaning, and not just the environment cleaning of the various devices, equipment, SOP for the laundry, the patient laundry and the staff laundry, sluicing, use of sodium hypochlorite and other chemicals, then use of utensils, cleaning, medical waste. Now, one of the most important fact that the problems that we faced was about the medical records. Can you please come to slide number 18, please? In case of medical records, there was an extreme fright among the staff that medical records would those who might to the worker. So what we did was we went for scanning of those records and archiving, dating to the patient system. People from the medical records department, they used to dawn in and they used to scan those documents. Discharge summaries were prepared online. Those were accessible to the head administrator. Give them to patient's attendant when the patient discharged. I think we can skip, come to the slide number. Yogita, can you hear me? Can you come to slide number 20? We've talked about medical records. Skip the next slide and come to management and monitoring of infection in slide number 20. Am I audible? Yeah. So this is in a nutshell what you do for the safety of your staff. For the infection prevention, you have administrative controls, separation of those areas, restricted access, adequate training, and patient to staff ratio is very essential. This is one of the very important satisfiers for the staff if they have adequate ratios. And you should have personal protective and chemoprophylaxis talked about. Come to slide number 21. Since we understand that there are a huge number of patients to the hospital, availability of medicines, disinfectants, and especially people is very critical in management. You can't just work without people. So your logistics and purchase department have to strengthen to ensure that medicine. So these are procured based on the clinical protocol, because once your clinical protocol is final, requirement, what it is you after your clinical protocol is final, able to procure medicine. Even for drug prophylaxis, had to control distribution of. There was a lot of black market going on, so have to do it in a controlled manner. You have a procurement committee. The entire world fell short of people. Now we have those in a good amount, but initial phases there was a huge crunch of and we closed there. So we formed a PP procurement committee. That was a technical specifications evaluation committee. They would inventory the potential suppliers. They would do regular tenders, open them, and award those tenders, and they use those and expedited payment, pay them with days. So they were able to tide over the extreme crunch situations and working day in and day out, procuring and medicine. So you need to dedicate your purchase and store staff for that. Apart from that, you a lot of space. A huge volume of word of people dedicated that entire facility for storage of those kits, and we made certain kits like ICU kits when in the COVID ICU, COVID kits, and they were only I marked the office and on. used to prepare those kits there in that facility. Uh, that struggle with what to fully completed bag kits. This number of staff that were. So this was a great job that we did in overcoming the shortages of people. We used to give like 5 sets of N95 masks with envelopes to all staff, and after like 5 days or so, and then after 20 days we issue those masks once again. Short like I'll tell in short about the biomedical waste. So nothing very confusing in that. These are double bags, red colored bags, labeled as COVID-19 case, store them separately. And there was a meeting how to waste that is generated from general types of waste where people classifying them as that they. So there was a clarification and guidelines issued. So we used to dispose them in black bags after wiping the outside of those bags. Dispose them as general waste. Similarly, the N95 mask discard them as general. To the treatment of the healthcare workers, the training of the healthcare workers. Sorry. So the training was basically carried out the following lines: clinical management, how to take care of patients, how to monitor what are the clinical protocol part of that patient management, and washing of hands, respiratory etiquette, cleaning and doffing of PPE, proper disposal of biometric tracing, disinfection, and protocol for reporting, isolation, contact traces. So this allayed much of the uncertainty and anxiety that the healthcare worker. So there was a clear-cut protocol that were laid down, and they were communicated able to have our staff working. Coming to the stress and anxiety among healthcare workers and family. So when there is uncertainty, they don't know what is what is the disease all about and how they will tackle the situation. So we have to have training told, and provision of PPEs was a huge leap. There was an issue like how they would source even people in the office area. They were given masks. So provision of PPEs is a must. Then we gave chemoprophylaxis and vaccination will be subsequent even. And we had temporary facilities where staff doesn't want to go to the home that they have. They are like high risk contact. So gave them temporary premises isolation, then isolation with no effect on salary. Then we had staff beds or the facility for those patients. For the outsourced staff who were not entitled to those facilities, people were happy working. To the family, they knew that their family.
Dr. Kausar, can we conclude it?
Yeah, I'll conclude. So just 10 seconds on each slide. Human resource management, you need to develop rosters. We had 3 days duties and 3 days off. Then we had 4 shifts, so you should know that you where to source. So we pooled in all the human resources and we deployed them in COVID areas on rotation basis. Regarding patient transport, you can skip this part because it was covered a bit. And to ensure continuing treatment of other illnesses, we ensured that OPDs were held, but they were regulated. We had limited patients coming to. Every patient would first go for online consultation. Doctor felt that the patient needs some sort of intervention. They called them physically to the number of patients were seen. Emergency was kept open. We separate screening areas and used to shift to COVID or SARI based on the continued with the chemotherapy, essential health. Communications, we used to have regulars. Leadership used to have was to upload those decisions taken, like starting when everything was nebulous. All decisions were taken collective wisdom. We have meeting to upload those data. And if you see AIMS Delhi, I used to be part of AIMS Delhi short while back. So we have a portal where information regarding. So coming on to the crux of it all, we actually generally follow management by committees. The last two slides. So we had a COVID task force, which was the overarching committee. They were the think tanks, what to do, how to, all committee that we focused on. Then we had a COVID clinical management committee, which took care of the patient care services in COVID areas. Then procurement committee, hospital infection control committee, with guidelines, various aspects of control. Human resource committee, they ensured that there was no shortage of staff. They developed rosters. They pooled in resources. They went for hiring of staff also. Then we had the equipment procurement of management committee. Just like the human resource, we pooled in the equipment resources, and we also bought certain other equipment. We got certain ventilators and monitors imported also, distributed to the COVID area. The routine purchase department. Coming to the conclusion part, the last slide. So after focusing on the risks part of it, various hazards and how to handle them, must draft your COVID-19 safety plan for your hospital under the following heads, strategies that we discussed. So you should have an instruction, management or leadership commitment, infection prevention control, communication, financing. We got separate budgets for that. And human resource management, the logistics, hospital pharmacy, how they are going to cater to the patient staff, or hospital lab, which for RT-PCR you need L2 and above. So we focus on that also. How you and how to manage concurrent emergencies, continuity of essential services, psychological and social support for your staff, and patient management and surge capacity. So this is like a format for developing safety COVID-19. Dr. Ali and all the panelists bearing me.
Thank you.
This presentation.
Thank you so much, Professor Saab. It's a wonderful presentation, but definitely we need to have another webinar on this aspect, which is very crucial and critical for safety of the hospitals. So we have to definitely organizing one more thing. But just one query, we are going for discussion that having a plan is just very important, no doubt. You develop the plan. You were there in AIMS as well. So in trauma center as well as in main building, there were fires. So how effective are those plans are in countering the disasters within the hospital environment? Just be brief.
I think the question is how about the fire safety.
We can't hear you.
Yeah, my question is COVID plan or fire?
No. But in general, the disaster management plan, or even in COVID times, we have seen a lot of fires, a lot of other hazards prevailing in the hospital environment. The issue is having a plan is one thing, and preventing the disaster or fire or any such incidences are different things. So how effective are these plans? Have you drilled sometime in AIMS? Like we have AIMS Delhi fire last year, AIMS Trauma Center fire. So I think there is a gap between having a plan and managing effectively those disasters with the help of fire, of this disaster management plan.
Dr. Amit?
Any idea if you have?
Yeah.
Otherwise, we can move ahead.
Yeah, can me?
Yes.
Yeah, actually that is a very burning question that you have. So no doubt I would share with I have a paper fire safety challenges on existing homes. So I have basically delved upon that the hospital faces or worldwide they face. So it is not just about aims, it's about it. So fire disasters are ubiquitous. Say just so if you see historically, fires have evolved. So we are like years old, wirings are old. So let me tell you about what are the steps that we have taken. Gone beyond the fire safety plan. We have evacuated far into the fire. That plan finally it has been drilled in.
You are not audible. Can we shift this question to RC Sharma sir? That he's having a lot of experience of all these things, and sir, having a plan is one thing. You develop a good plan, but are those plans effective? This is question number one. And second question from my side is from participants as well, that Jugal Kishore sir was mentioning about those temporary hospitals. So how effective are those temporary hospitals in countering the fires?
See, when you talk about the plans, something you have to have it. There's no other way out. Otherwise, you don't know what is where to go in case some problem is there. Do we have certain facilities with us or not? And who's going to do what? So again, just having a plan is good, but having a plan alone doesn't help. Yes. We have to everybody has to know about it. And sometimes we should be able to rehearse it or try to really activate it, see whether everybody is aware of it. And is the plan useful to us, or do we need to bring in some changes somewhere? Otherwise, having a plan on paper just because it is required and then keep it in Almira is going to be useful. So having a plan, let everybody be part of it. They must know about it, and then rehearse it sometime and activate it, maybe just to ensure that
Okay. And the second part, sir?
And so far as the temporary arrangements is concerned, see, the thing is, normally so far as the things are non-combustible, I think there is no problem. But when we are using PVC materials for constructing something, temporary structures and all that, well, so long nothing happens, it's okay. But these one advantage in these structure, I feel, is if it is combustible and there is some problem and it burns, then things will go out because it is not going to sustain that long in a fire. So if it is burning away, probably maybe ceiling burns off, then things do not spread to that adjacent area. It's a large tent or something like that. But if it is able to sustain and then things are burning and creating smoke, is a problem. So it's just like a pandal. I mean, when we were talking about a lot of pandal fires were there earlier. So their situation was again the same. When you're creating such a facility, see that, are we going to create a problem because of this fire? And if we are creating that situation where you have got air conditioners into that, you've got other highly inflammable things available there, and probably you put it on a raised maybe wooden platform or something like that. And so many things are there. Electricity is being used left, right, and center. The equipments are there. So if something goes wrong, then what we are going to do? Will we be able to take care of the safety from for the people who are inside, patients? Can we shift them? Something like that. So just we have to bear in mind that angle as well while using anything, maybe a temporary facility or a permanent facility. That doesn't make difference.
Okay. So having a plan is definitely one thing, and knowing it and implementing it and getting good results out of this is definitely different thing. So we have to practice a lot, and then we have to make that plan.
And sir, one more thing in that. One more thing I would like to make is, I mean, it is something when see, people are not available to you, your own staff is reduced, and hospital staff, doctors, and they have to be 100% aware of the facility inside. I mean, if they don't know anything about this, then we had it, because they themselves will be into problem. So they should be something who can do something little bit, and we can't really leave it to others. Because we have got maintenance people, we have got fire brigade next to us. No, not at all. Everybody in the hospital, they must be knowing about the facilities, maybe the smoke management, venting, or maybe fires, your switches, main switches where you switch off, and whatever fire extinguishers and other equipment you do have. Maybe a jug of water or a little thing can be useful in one time. If you are able to switch off, you know where is the control panel, can help. Otherwise, things can escalate. So involvement of in-house people is a must.
Thank you, sir. Behel sir, how critical is to develop those temporary facilities, and do we take care of those materials used in developing those facilities? Or I don't know, at your level when you are planning for a temporary facility. So what are the solutions?
So we had COVID centers. We had COVID centers like banquet hall, other things. Selection was sorted out according to other administrative concerns. Yeah, banquet halls, other guest houses, and other headquarters converted on that area. You are very right. We have not paid much attention to the fire as such, but as these guest houses and banquet halls have the inbuilt fire arrangement, so we suppose they should have taken care of it. I do remember. Do you know in orthopedics we use plaster of Paris, POP cast, plaster of Paris. In Paris, what used to happen? They had the wooden houses, all built up wooden, and they used to catch fire. So what they did, the king did. He said all the houses have to be lined by lime. So they were all lined by lime, and it never caught fire. It was a good just. It came down to my mind. So you have to have non-combustible material as far as possible. If the wood is there, let it be iron, steel from the outside inside, so that it should not catch fire. And fire control measures have to be there. And for that, Sharma ji is very good. He'll part with it and do something. So this is the way we do. But if we have, otherwise we have temporary hospitals. All of these temporary hospitals are basically in tents. All temporary hospitals which UNO or somebody have built up, and we had mobile hospitals Army have put up. They are all in tents. So I know fire sector, you have to be cautious. Material will be only which is mobile, enable, which can be used at that lower heights or wherever we are. Temporary system have to prevail, and you have to be very cautious. And preventions are the best strategies, I think.
So we go by the requirement. The requirement at the time is to find a place to house the patients. So we try to. We cannot make them ideal for this, because like a hospital is a sleeping accommodation for the people who are not able to move themselves. If we house them in maybe a pandal or maybe a marriage pandal or something like that, you can't create those facilities. So it is not feasible rather. Right. So but then we have to think of some alternate arrangement.
And Sharma साहब एक question और है.
In that situation, so we have to plan for that.
So this is only fire thing, but the question is why ICUs are the maximum in those fire incidences. ICU में ही आग क्यों लगता है सर ज्यादातर?
Sir, ICU में इसलिए लगता है probably. See, as I told you in the beginning, I said that we use more of electricity, more of equipment in ICU. You got support functions, various support function for a patient. So you got so much of gadgets over there to support the patient that chances of fire from those electrical things become more. It's just as simple as that. And you may be having some other things like you are having oxygen. I mean, a small spark in the normal situation may not create a problem, but if you are having oxygen, more oxygen in atmosphere, that becomes a little more, supportive for that fire. So these are the various things which make such facilities fire prone, because you do have various things which can really add to the problem.
Last words and the message from this webinar for protection of safety of infrastructure in hospital environment. Your last words.
So for everything, so the last word for everything like this is that we have to be aware of our surroundings. We have to identify which is the risk available there. And maybe as I was talking about COVID, how we can spread. So we have, if we know how it can spread, we can know how we can prevent it. So being little aware of the situation, possibility of fire occurring there, how we can reduce it. It's not really that big science that we simply see that, okay, whatever equipment is there, think that it can have fire, and we can make arrangement to see that it doesn't escalate, create a problem for the rest of the people who are living there. So being aware of our surroundings, risk, I think that's good enough. And take care of it.
Okay. Behel Sahab, message from this webinar, the safety and security of the infrastructure in hospital environment.
Yeah, that's right. First, that's very important to create an awareness. People have to be aware of basic facts, basically, and media has to come for the rescue. They have to highlight the various ways of transmissibility of the disease, what could be done, and how we can all work together. Work together. I mean to say, I do remember there was a case. We had a senior resident of ours. So he was living in one of the houses, Basant Kunj. When his landlord knew that he is a tenant and he is working in a COVID hospital, he was thrown out. All bag and badges, they were kept out so that he should shift from that area. So we have to be morally bound also. It's not that the few people, we have to have moral values. We have to understand a man is working for others. Rather than helping him, you make him out also. So these small things which play very part, and all that is awareness basically. You have to spread the message far and wide. What is the requirement? How we can help in a nice way means we can get the things on, and what are the precautions to be taken. For example, whenever these things do turn up, can you imagine what doctors need to use? N95 is born in the street also. Why? Why should it be? It's a rare commodity, has to be used in the hospital premises. So this rationing of the system and PPEs, etc. When we talk about that things, you give them substandard things and not in sufficient quantity. The things are bound to deteriorate. And when you think of the infrastructure, you have to put a lot many things onto it. Look for the logistics port. Logistics port need to be there. If you have many things available, then you can have many ways of putting the, for example, we say, no, we have many ways of putting the fire, so we can go ahead in that purview also.
Thank you, sir. So with this, we just conclude the proceedings of the webinar. Dropped out. So Yogita, you can take over and conclude the webinar.
Thank you. I think just a bit of science, I would like to say very first. The, I think the this important detail. I am and the
So I also join in extending my warm Kishore. Sharma Saab, it's always a pleasure. Well, Saab, it's wonderful to have you on our panel. So much for this webinar. I also take this opportunity to thank our executive director sir, for guiding us, for providing all those necessary inputs in finalizing the program and all those things. He always enough to give us this liberty to experiment and come out with the new topic and a series of webinars. Sir, for guiding us and for your encouragement. Thanks to Yogita, wonderfully coordinated every time. So thank you so much to Yogita as well. And thank you to all the participants for participation. And Sharma Saab, I thoda sa ho gaya hai, sorry for that.
It's okay, okay, right.
It's always we tried our best, but we slightly late in the beginning, some technical issues.
No, it's okay.
So thank you so much for being with us. So thank you all the participants for joining us, and thank you always. So we have two webinars next week. So one is on retrofitting, and another is retrofitting of infrastructure facilities, and another is on traditional housing systems in Tripura. So if you are interested, please look on the advertisement of our website, and then you can join. So we are planning another series, maybe one exclusively on hospital disaster management plan, one exclusively on hospital fires, or those programs are in pipeline. So just wait for another series of webinars which we are going to launch soon, exclusively on these aspects. And with this, we just conclude it here. So thank you all for being with us for this webinar. Thank you, Yogita. Thank you, our NIDM team.
Okay, right, sir. Thank you.
And all those people. Thank you so much, sir.
Thank you.
It's wonderful to have you. Yogita, you will close it now. Thank you.
I'm just reading.